This is Open Line.
Good evening, everyone, and welcome to Open Line. Thank you for joining us so much on this Monday evening. I am glad to be back with you after, gosh, it seems like a few weeks off. I'm Carrie Sharp, and tonight's topic, we're talking with two doctors who are with the group Protect My Care. And Protect My Care is calling on the U.S. Justice Department to investigate Governor Bill Lee for his handling of the COVID-19 pandemic. We're going to dig into that, but I do want to remind you, this is Open Line. This is a chance for you to sound off and also have your questions answered. So I would love to introduce you to my guest tonight. I have Dr. Jason Martin, who is an ICU doctor in Sumner County. Thank you for being here.
Thanks for having me.
And Dr. Vidya Bansal, who is a pediatrician. Welcome.
Thank you very much for having us.
Before we jump into the nitty-gritty of this topic, because there is a lot to talk about, I would just like you to introduce yourself to our audience and tell them what you do day in, day out. We'll start with you, Dr. Martin.
Sure, yeah, Jason Martin. I'm a pulmonary critical care doc in Sumner County. So I work mainly with intensive care unit medicine. I take care of patients who are critically ill. Also a husband and dad of 3 girls.
Gotcha. Dr. Bansal?
I'm a board-certified pediatrician here in the Nashville area. Grew up in Nashville, did my training, and returned back home. I am a wife and a mom of a beautiful 9-year-old boy, and I do general pediatrics, and so I see babies all the way up to age 18. And I also am the executive director of a nonprofit with 7,000 physician women members.
Fantastic. So both of you, what I'm hearing, have your hands and have had your hands in this COVID-19 pandemic since the get-go, right?
Correct.
You've probably seen all sides of it. Dr. Martin, you're a pulmonologist in the ICU, so
That's
you
right.
are really in the thick of it. I want to know what you're seeing right now with this Delta variant that maybe is different than what you have seen over the past 15 months, if
Sure.
there's anything?
Yeah, well, the Delta variant is very serious. We're super concerned about it in the clinical practice arena. It's much more contagious. So if you pick up the virus, you're more likely to spread it to other people. Also, if you pick up the Delta variant, you're much more likely to land in the hospital. So it's really a double whammy. So we want to do everything we can to prevent the spread of that virus in our community. We are seeing younger and younger patients in the ICU this round. I think it's because vaccine adoption has been higher in older groups, and so the young folks are the ones who are unvaccinated, and unfortunately some of them are getting critically ill and dying.
What is your message to folks sitting at home who maybe haven't been vaccinated at this point?
Sure. Yeah, we want people to ask the tough questions about the vaccine. We want people to do research, look at the data, because the data is clear. The vaccine is safe and effective. The vaccine is the way out of this pandemic for Tennessee. It's the way we keep our kids safe at school. It's the way we keep our businesses open. It's the way we keep our family and friends safe. So I want to tell people that, we've looked at the data very carefully. The vaccine is safe, it's effective, it's free, and it's plentiful. So please take it.
I want to talk more about the Delta variant as we go on over the next hour, but you mentioned school, which is about ready to ramp back up, and that is really your thing, dealing with children. Kids 12 and older can get vaccinated, but 12 and under cannot, which puts families and schools kind of in this weird limbo of how do we approach this next school year? What are you telling the families who come in?
That's a great question. So over the age of 12, you're right. Children are eligible to get the vaccine, but we have seen a vaccine hesitancy even above the age of 12. So less than half of children over the age of 12 who are eligible to get the vaccine have received that vaccine. We have school approaching, and of course, under the age of 12, we're still waiting on some data from clinical trials that should be out, but won't be out until this fall. And then we'll have to roll out those vaccines. It will probably also be age stratified. Not privy to that information, of course, but probably age stratified where the youngest children will get it last. And those are the children who are actually most susceptible to getting disease, spreading infection among themselves. Every parent will tell you what happens when their kids start daycare or they start school for the first time. Illnesses galore.
Yes.
We saw very little of that last year because we got into aggressive hand washing. You saw 3-year-olds, and it was so cute, learning to wash their hands. And it was effective, it was very powerful, and that helped to limit the spread. So as Dr. Martin eloquently said, we have the elderly population who is now just about adequately vaccinated, and that's great. And what we need to do now is redirect our education towards parents and towards teenagers and even younger children to do those preventative measures such as mask wearing in school, washing their hands, continuing social distancing, and also getting vaccinated when it's their turn.
And as a parent myself of little ones, I have a 6 and an 8-year-old, we have just mentally prepared. We always call it snot timber because that's what it turns into be. But it's not just COVID that will ramp up. It is every little cold and germ that children have not been exposed to because we've been apart even so much as being at home in our homes and not around kids, right? And other people.
Absolutely. And that's what's going to drive a lot of this confusion. When COVID first hit in children, the pediatrician community here in Middle Tennessee and throughout the country and throughout the world really had a lot of confusion. We didn't have a lot of data in adults, and we had even less in children. We were relying on our international partners throughout the world to help guide us with this. And as coronavirus moved from country to country, we received experience from them. There were no journals and there were no textbooks to guide us into what we were supposed to be doing. So a lot of the pediatric symptoms that presented in the spring of last year, when it was allergy season here in Middle Tennessee, a lot of it mimicked what could be coronavirus. And so a lot of us didn't really know what to do, and we were of course thinking the worst because it's better to be prepared. And so we're looking at that going into this fall. Is it a cold? Is it allergies? Is it just, you know, kids, the common cold that's just passing back and forth? But then parents are going to get nervous because you just don't know. Is it flu? Is it allergies? Is it a cold? Or is it coronavirus?
Yeah. All these new symptoms and questions you have to continually ask yourself in the home every night when the kid comes home. It's like, okay, how you feeling? How you looking? Okay, the reason why you all came on tonight is to talk about what the group Protect My Care is doing. You all have petitioned the U.S. Justice Department to investigate Governor Bill Lee. That's a big step. Why are you taking that step?
Sure, so I'll take that one. You know, the vaccines are the way we move forward. They're the way that we keep our population protected and safe. And in the middle of a pandemic, the governor has chosen to fire the chief vaccine officer at the Department of Health. And based on media reports, it appears that it was purely political. It appears that it's purely in response to outrage, I guess, from the Government Operations Committee and related to the mature minor doctrine here in Tennessee, which incidentally has been Tennessee law and practice for decades, right? And Dr. Fiscus was simply recapitulating that policy when she came under fire. So I think it's a complete lack of leadership for her to get fired when we need her the most in the middle of a pandemic. And I got to tell you, you know, as a clinician, if I have a life-saving therapy that I withhold from a patient and that patient is harmed, that's the definition of malpractice, negligence that leads to harm. And so in this case, I think there's a case to be made that Bill Lee is behaving negligently, and he's going to cause harm to Tennesseans. And if the Department of Health is not able to effectively perform its job, if it's not able to effectively perform outreach for vaccinations, people are going to die. And that harm, you know, I think that he has potentially some culpability for that harm, and so we want an investigation.
Has the Justice Department responded to the request?
The request has been submitted. We're waiting to hear back.
What would you like to see the Justice Department actually do?
So I would like to see, again, an investigation into Bill Lee's practices and decision making, because I think his lack of leadership has been bad for the state of Tennessee and for its people. Over the last 18 months, I've held up a lot of iPads while moms and dads and brothers and sisters wailed at the loss of their loved ones remotely. And I think there needs to be a review of the practices of the last 18 months, and particularly related to Fiscus's firing, because it's just not right.
I can see, just because we're a couple of feet apart, you got a little choked up saying that.
Yeah,
this impacts you.
This is real for me. It's real for the people who are at the bedside every day, taking care of these folks. I mean, I've personally presided over 100 people's death. And, you know, the terrible tragedy about what's happening right now is that the deaths we're witnessing now are preventable. Preventable. If the messaging at the top was consistent, if people were standing, you know, in the Government Operations Committee talking about how vaccines save lives, fewer people would be dying in Tennessee. They have some responsibility, and someone needs to stand up and call them out on it.
And so that's what this group is doing.
That's exactly what we're doing.
Do you expect a response soon? Do you have any timeline, any past experience of what you might see or hear?
So what I tell people is I'm just a country doctor. You know, I'm a critical care doctor in Sumner County. My job is to take care of the folks that come in the ICU, and I let the lawyers take care of their job.
It really seemed that things started to, excuse me, spiral downward with new momentum when it came to this mature minor doctrine. And you being a pediatrician, I wonder how much has this actually come up in your practice before COVID?
Well, before I get into that, I just want to agree 100% with Dr. Martin. And just to follow up on that, my husband was one of those sons on that iPad with his father intubated in the ICU and having to make that decision when he is not a physician. And so the decision came to me as to all of the medical care and then deciding to end care. So it's not just that we are here as physicians, we're also here as sons and daughters and parents ourselves. And we do not push anything onto the community. We don't push anything down onto the community ever. We educate the community, but we're also the community. We're also the people that this impacts. And we're on the front lines, just like law enforcement, just like teachers, just like grocery store workers are on the front line. So when something like this happens, it's not just about the physicians and it's not only about our patients. We too are patients, and we too are susceptible to all of these negative outcomes that are made by these decisions. Going back to the doctrine, as Dr. Martin said, this is something that was there since the 1980s. This is nothing new. And prior to this issue, with everything being in the news as of last week, it's hard to imagine that it's only been 1 week as of today, really. It's not something that's come up. I have never had a parent ask me about it. Now, we as pediatricians are trained to provide two things to teenage patients, and that is actually just the way that we were trained. It's part of our medical society. It's part of national law, in fact, and that is for certain aspects of medical care that teenagers have the right to decide for themselves. The reason why this became such a big issue is because it was completely misconstrued. No one is forcing children to do things and encouraging them to hide it from their parents. No one is going in, and there's no conspiracy in shooting up children without parents knowing it. It's become a big deal because of the way that it was misconstrued. This campaign was merely about, as Dr. Martin said, communicating something which was long pre-existing. And if anyone had a problem with the law, they should have taken it up with the lawmakers to change the law rather than scapegoat the person who was not only doing her job as the right job to do for her, it was the right job to do for Tennesseans. And that is where I want to see leadership that is more concerned about the safety and livelihood and life and death of Tennesseans, and not using taxpayer money to pay for vacations for people to come to Tennessee, and we have no idea what they're doing, and we have no idea if they're vaccinated, we have no idea what they're carrying infections from. The new variant is particularly worrisome in this paid vacation campaign, because for every one person who carries the Delta variant is more likely to infect more people than the other variants have. The R naught value is 6, so Dr. Martin can speak more about the data on this, but it means that every one person with the Delta variant is likely to infect 6 more people when the rate was much lower for the other variants. So this is particularly worrisome when we have a misdirected leadership. And I would like to know, what is the mission here? Is the mission to protect Tennesseans, or is the mission to bring more infection to Tennessee?
Let's jump to the lines, because this is Open Line. We have Faith standing by, our first caller of the night. Faith, you are on the air. You may go ahead.
Hi, good evening. It's so nice to hear this discussion. I'm on the opposite side of the fence and just wonder what either of your guests think about the recent reports that the VAERS, VAERS website, the vaccine injury website for doctors to report, has been underreporting the deaths, and there's actually 45,000 Americans that have been killed by this so-called vaccine, which, by the way, I don't call it a vaccine at all.
Okay, let's talk about it. Thank you, Ann, for calling in. I'm going to hang up so you can listen to your TV. I appreciate it. Let's talk about this. There have been side effects of this vaccine, just like any vaccine. How do you talk to people about that? How do you respond?
You know, first of all, Faith, thank you for your call. We invite people to bring their concerns about the vaccine to us. You know, that's the only way that we're gonna, potentially move the ball down the court, is if people who have reservations come to us so we can discuss them. The vaccine is very safe. It's not, 100% risk-free. There have been some adverse events. Those have been tracked. I can tell you, though, the adverse events related to COVID-19 are far more serious and far more common than with the vaccine. And so I think everyone has to thoughtfully do the math for themselves, but the science tells us that the vaccine is extremely, extremely safe and nearly 100% effective at preventing life-threatening disease from the virus. And so, you know, for me, swimming in COVID all day in the ICU, it was simple arithmetic. And I got to tell you, for folks walking around unvaccinated in the community with the Delta variant running around, I think you're also going to be better off getting the vaccine as well.
Okay, let's get back to the lines. Rob is on the line. Rob, thank you for being with us. Go ahead.
Hello?
Hi, go ahead, Rob.
Yeah, I'm just trying to play a little scenario here. I know there's, everybody's like, you got to take the vaccination, got to take the vaccination. You know, the vaccinated people, if you go into a store and you don't wear a mask or you wouldn't, you know, they kind of flip out. And I'm like, well, you're wearing a mask, you know, you shouldn't be worried about me. Versus non-vaccinated. If it's Trump supporters, hey, man, if they don't get vaccinated, they fall off the earth, I guess everybody'd be happy. Long story short, my mom asked me, she called me and asked me, she said, should I get vaccinated? And this is what I told her. I said, if you want to get vaccinated, get it. If you don't, don't. It's not up to me. It's not up to the government. And that's about as simple as I can make it. You know, the government can't make me do something I don't want to do. And I'll leave it at that. Love everybody, and you can take that and run with it.
All right. Thank you, Rob, very much for calling in. Appreciate hearing from you tonight. Are you all for mandated vaccines?
Well, I think that the discussion needs to go from that question to more of a discussion of let's look at the outcome and let's look at the risk.
Okay.
So when we talk about adverse effects, if you take 1 million people and if you don't do anything to them, and if you just follow them for a month or two, you're going to have 20 or 30 people come down with something. That's just the nature of math. It's just the nature of statistics. Now, if you had, let's say 10, if you had something happen to 10 of those people, now let's go back and let's say we vaccinated those people. And now let's say 12 people came down with the same hypothetical condition. Was it the vaccine, or there's not a big difference between 10 and 12? Is it that 2 people got the condition and it was due to the vaccine and 10 were due to chance, or is it 12 people? When you look at the side effects for all vaccines, and vaccines have been around for a long time, there is no serious adverse effect from vaccines beyond 2 months. It's never been reported. Beyond 2 months, it doesn't happen. People don't die from vaccines after 2 months. It just doesn't happen. We have to look at where we're getting our information from. And I agree there has been some confusion with the CDC lately. Well, actually, since this started. Last spring, when we first started seeing this, there was a lot of controversy about mask itself. And with the masks, we didn't have the data. And it takes time to collect data. You have to collect it. You have to have a team of epidemiologists looking at it and then making decisions. That doesn't happen overnight. So this was something that none of us were prepared for. None of us knew what to do with it. But the scientists and the doctors followed everything that was followed from previous outbreaks, and we learn from those. And every time we have a pandemic, this isn't the first. Everyone knows what the term pandemic means now, but the word pandemic has been around for a long time for doctors and scientists. And we've studied it, and we take that data and we run with it. So none of this is new to us in the sense the baseline is not new. It's just that coronavirus is new. And that's where we have the studies on the safety of a lot of vaccines and not just the coronavirus vaccine.
But this is a very different vaccine. I mean, it's been touted as this is the first of its kind.
Well, it's the first of its kind in the sense that technology, I mean, we didn't have cell phones 20 years ago.
Right.
So,
but when you compare it to vaccines that are already on the market, it is not that vaccine.
It's better.
Do we know that?
It's better in terms of the technology, and it's not actually injecting a virus particle. And this is where I urge people to find out where they're getting their information from. It doesn't change DNA. It doesn't make metal stick to you. You don't turn into a magnet. You know, you have to look at where you're getting your information from. And if you're getting information from a reliable source, then you'll get the same facts that the doctors and scientists have.
Very good. We have to sneak in a quick break because we've gone way over already, but we're going to have more of your questions and calls when we return. And I know that you are still on the line and several others, so stay with us.